Hi, Dr. Mayberry and Gertie again. We're going to continue our skull discussion with the occipital and the sphenoid. So the occipital bone is the posterior portion of your skull, and this is the foramen magnum, so the inferior portion. So your spinal cord actually exits your brain through the foramen magnum, which literally means big hole. So the foramen magnum in bipeds is underneath the skull, whereas in quadrupeds it's actually more toward the back of the skull. So that's important in terms of studying, other organisms. So foramen magnum. The other foramina in the occipital bone is, well, there are two. So they're both the hypoglossal canal. So it actually sits like this in the skull. So you have one on either side here. Hypoglossal nerve goes through those holes. We say that the occipital looks a little bit like a snake. See? So this is clivus. The name of the snake, the nose of the snake, clivus. Excuse me. So the other landmarks that you need to know on the occipital are actually what we'll use again when we talk about sex determination with the skull. So you have this external occipital protuberance, this bump here, which is variable in individuals. You have an external occipital crest, which is going superiorly, inferiorly here. And then you have two nuchal lines, the superior nuchal line and the inferior nuchal line. And so those are primarily muscle attachments, so they do vary in individuals depending on the robusticity of the muscles. So those are going to be very useful for us later in the semester. Otherwise, there are additional landmarks on the occipital, but they're not landmarks that I quiz you on. What you do need to realize, though, is that these articular facets actually articulate with C1, right? The superior articular facets on C1. So if I tag them and say, what do these articulate with? That's the answer. If I tag the superior articular facets on C1, which of course is the atlas, then you need to know that they articulate with the occipital bone. Okay, so be aware of that. Okay, the sphenoid, we say looks like a bat. Okay, so far we have a triceratops, a snake, and a bat. Welcome to your skull. So this is the sphenoid. On the inside of the skull, the sphenoid is here. And these skulls with the cuts, they do show up on your lab practical. So you do need to be able to recognize them there too. So this is all sphenoid in here. There are several landmarks on the sphenoid. The sphenoid is very complicated. It actually, when we talk about ossification, the sphenoid has 14 ossification centers as it forms. So it's appropriately complicated. So the bat has these major wings. So these are actually the greater wings of the sphenoid. The lesser wings of the sphenoid are up here. Okay? These, I always mess this up, are the pterygoid plates, which starts with a P. Okay? So the pterygoid plates, and there's a lateral on either side and a medial on either side. Okay? So those are like the feet of the bat, I guess you could say. We have the superior orbital fissure up here. There's also an inferior orbital fissure. You can't see it unless the sphenoid is articulated. So the inferior orbital fissure is actually here on either orbit, rather. So it's actually basically right there. So just be aware that in an articulated skull, I can tag the inferior orbital fissure, but I can't do it in a disarticulated sphenoid. Okay, I can do the superior orbital fissure. We do have foramina in the sphenoid as well. This is actually the optic canal here, and that is for cranial nerve 2, which is your optic, so your sight is dependent on cranial nerve 2 and the optic canal. We also have the Sella Turcica. So the Sella Turcica is where I'm wrapping my pipe cleaner right now. So if I sit this sphenoid like this, in your skull it's sort of like that. So let's look at it from the posterior. This is the Sella Turcica. I've always thought of it as another saddle, and my pipe cleaner is like the person sitting on the saddle, and the legs go down either side. So the Sella Turcica on the Sella Turcica is the hypophyseal fossa, and the hypothalamus sits there, but also the optic chiasm, where the optic nerves cross in your skull, happens right there. So very important location, centrally located, which you can sort of tell inside the skull there. So it's right there. So Sella Turcica is very important. Let's make sure I've gotten everything. Oh, I haven't. We have a couple more foramina. So there are sort of three smaller holes. The more anterior round one is the foramen rotundum. Posterior to that is an oval-shaped one, which is the foramen ovale. And then little bitsy tiny behind that is foramen spinosum. Okay? So rotundum, ovale, and spinosum, moving anteriorly to posteriorly. So I don't actually have a mnemonic device or anything for those, but spinosum is very tiny, ovale is appropriately an oval, and rotundum is round and more anterior. Okay, so just know that you have those different foramina in the sphenoid. And with that, I have discussed all of the landmarks you need to know for the sphenoid. There is no siding because there's only one. You should realize that this is the anterior and this is the posterior of the sphenoid. Okay, and you do need to be able to locate it in the cross-section skull. So with that, you can continue on to the next lecture and ask me any questions that you have in class.